Preceptors often are asking, how can I deliver a quality rotation? We're going to be giving preceptors the resources to, not only learn the didactic best practices, but also learn the administrative and the organizational practices associated with running rotation.
If a preceptor is truly committed, and I know they all are, to bedside education and really reinforced with didactic information that supports the perspectives, it really makes a difference. And when there is an example to give a student, they may know everything in the textbook. It doesn't come to life until it's three-dimensional with a preceptor to explain it effectively and let them know what you saw in the book also has nuances, and what you saw in the book is really about a patient, and this is what you see.
I always tell preceptors, you should provide a really detailed description with required reading, recommended skills. You should set up a very standardized orientation procedure, set up structured didactic times where you can do chart review, case presentation, times to meet with the student outside of the patient visit, build in a mid-rotation evaluation, and generally follow a very structured schedule rather than something free-form. I've always found that tends to lead to better outcomes overall.
You should be asking them, what are your goals? Where do you see yourself? What type of a program do you want to train in to make sure that the students are getting the most out of that rotation?
Preceptors can really help with the quality by allowing the students to actually get the same experiences that they're giving. I think that's a really hard thing for preceptors to kind of give up the control, but I do think that they have that experience, and that's why they're great providers. And so if they can give that kind of quality to their student in rotation, that they'll be, giving back really to the healthcare community.
We know that didactic information is critically important, but how that information is then applied to real settings is essential to a great experience for a student and for who will then become a care provider. Preceptors are the link that bridges those two sides of the story.
At the core of everything they do is that apprenticeship model that started with ancient Greeks, and they're teaching the same thing. They're passing that gift along. You've got everything there. You don't have to do anything except for engage with that student, make that student part of your experience, part of your team, and invest in them as you were invested in at some point in your career. Because those moments are what light a fire in a student to maybe not become like what you want them to be, but become what they need to be.